my name is Michaela, and today I'm going to be talking to you guys a little bit about my internship experience working for Adventist Healthcare. So to start off, a little bit about the company. They are a private faith-based organization that has about 6,000 employees system-wide. They are the largest employer in Montgomery County, Maryland, owning 3 medical centers, which you may have heard of before: Shady Grove Medical Center, Fort Washington Medical Center, and White Oak Medical Center. We also manage Howard University Hospital out in DC as well, and we have a good amount of urgent care scattered throughout the county. I work in the LifeWorks Strategies Department, which falls under the sector of HR and employee health, and we work closely with the Employee Assistance Program, or the EAP, to better the work-life balance of all of the employees here. Through the EAP, all of our employees are able to access free aid in areas like child care, elder care, financial education, legal advice. The list goes on. Anything that you can think of that's going to better the mental health and wellness of our employees, we offer it to them for free. That is what we do internally, and now externally we sell those same services to employers throughout the country and even internationally now. I worked about 30 to 40 hours a week in this internship. You are required to hit 450 minimum, which I know on paper looks like a lot, but if you average it out, it's only 30 hours a week. So I hit a little bit more than that each week, so that now at the end of my internship, I never had to stress to get more hours. I also had to be both in and out of office for this internship. Flu vaccines and N95 fit testings are both conditions of employment here at Adventist Healthcare. And so my department houses those clinics for employees to meet that requirement a little bit easier. Flu season ran from September 17th to November 12th. And so in the peak of that season, I was in a clinic about 1 to 3 days a week working as an admin. So that would entail badging in employees, making sure they check in properly to get the credit that they need, going through their consent thoroughly to ensure that nothing that they filled out is going to conflict with them getting the vaccine that day. So the things like being pregnant, having a reaction in the past to the vaccine, feeling under the weather that day, or having a certain neurological disorder are all things that will conflict with them getting the vaccine. And so we need to be in constant communication with the nurse in regards to that. I'm also filling out the vaccine information. So the lot number of the vaccine, the brand name of the vaccine, and who administered the shot. Those are things that we just need to keep on file. N95 fit testings, I'm working as an admin, but I'm also performing them as well. You, as an intern coming in during the spring, will be in a fit testing about 1 to 3 days a week, but because I came in during flu season, I only had time for about 1 to 3 times a month. How I chose my site was primarily based on location, so I live about 5 minutes from the support center, so that was an easy check off my list. Virtual versus in-person, I was somebody that can roll out of bed and go to class and pass them just fine, but I needed my internship to be in person so that I can grow certain skills that would allow me to advance in my career, and I felt like that would be done best in person. Both my parents work for Adventist Healthcare, so I was familiar with the company. And during my interview and meet and greet, I was able to understand the team dynamic and felt like I would fit in with them well. They also prioritize mental health, which you see a lot of people and companies saying that they do, but I really got the sense that they practice what they preached. And so that was something that was really attractive to me. I also learned my day-to-day tasks and that they would be a mixture of clinical and administrative work, which I didn't see from the list of sites. They were mostly all clinical or all administrative, and I didn't really know what I wanted to do after I graduated, so this allowed me to pinpoint what I want to do now after I graduate. Some considerations to make are your ideal work environment. So again, do you like working in person or do you like working virtually? The company and the team values, do you think that you'll fit in with the team? Do you think you'll work well with them? And do you think you'll get along with the company's values as well? And can you see yourself working there day to day? And your future, does your goals or do your goals align well with the company and the site? And can they help you, can they set you up for success after you graduate? Those are things to consider. So my projects seem to be a little bit smaller than those of my peers in the program. I have about 3 to 4 projects, and they are week-to-week projects, month-to-month projects. I don't have an end of internship presentation or a bulletin board or reports that I run. So my main project is to plan free monthly webinars that promote our services and educate the community. So in the beginning of my internship, we sat down as a team and brainstormed each month theme. And my job is to take those themes and turn them into real life webinars. So that process entails figuring out who I want to present, because I'm not going to be the one presenting. I mediate the presentations, but I need somebody that's going to present the information that we have. So getting in contact with the presenter, seeing if they would be interested, picking a time and a date, setting up the webinar, making sure that the platform is created to the brand standards of Adventist Healthcare, and then promoting the event. So, for example, tomorrow is my last event. It's also my last day of the internship, and so the event that we're having for December is on goal setting. And I wanted it to be a dual collaboration to get a general concept of goal setting. So our EAP counselor is going to be doing that, Kathleen. And then I wanted to also tie in some financial aspects of it as well, so that people can learn how to set themselves up for success going into the new year and preparing their financials and getting back on track after they've spent all this money for the holidays. So got in contact with Hunter, who's a financial educator with Lincoln Financial, and so you work both in and out of the company, so it allowed me to grow my communication skills with that as well. And so yeah, I'm really excited for that. That's tomorrow. Some likes and dislikes are the team. Like I said, they're really supportive. I've never been afraid to bring my ideas or my opinions to them, which I feel like is really important as we're transitioning into our career. Going into your career scared to bring something to your boss is not going to set yourself up for success. So they are really supportive, and I get along with them great. The pride in the work that I'm putting out, so it's really rewarding to be able to take an idea like a brainstorm and turn it into a real live event, or turn it into something, and take your education that you've been working on for the past 4 years and finally be able to use it and not just be reading a textbook and acting like a zombie. Also, I get to be creative. So like I said, I have numerous projects, and one of them is to create graphics for our LinkedIn page to grow that site. And so I get to take my interest for art and put it into that. And I also put out a weekly newsletter, so I get to be creative and grow my writing skills in that department as well. My only dislike, and this is literally my only dislike working for Adventist Healthcare, or even just the program, it's not even Adventist Healthcare, is that we pay more for the semester to work for free, and that is not in our control, and you just have to get over it and be appreciative and grateful for the experience that Towson gets to give you, and that you'll be able to take throughout your career. What I've learned at Towson that I didn't think I would ever use again is anything that came out of Health 432. So the models and data analysis, all that jazz, trans-theoretical model, sociocognitive model, all of it. I did not want to use it in my career, but we do. My team members use it for their data analysis and needs assessment, working with their clients. And also program planning and event planning. I use that in the monthly events that I plan, knowing your audience and everything that you learn in Health 430 I had Professor Mickey, and you use all of that. So what I wish that I learned at Towson that I did not is that health and science move incredibly fast. This is something that's common sense, but I just don't remember learning it in class, and that I learned that very quickly in my first week here when we were brainstorming for the events. So yeah. Some words of wisdom to leave you guys off with are to be confident in what you're doing and to hold your head up high, walk with your head held high when you're walking through the hallways, in your meetings. Speak up about your opinions and your ideas, even if you don't think that they're the best ideas, even if you think that your team has used those before and they haven't worked. You're going into this with a fresh mind and you have no idea what your team has done. So just speak up and they will make a note of that, and you will also look a lot better to them and to anybody that you're working with. So I wish you guys good luck in your site selection and in your internships next semester. Thank you for listening.